Medication safety. Make the right choice. A few of the topics we will discuss include communication, delegation, and preparation, medication administration and storage, medication rights, something you need to do with each and every medication, the MAR requirements, the medication administration record, and what needs to be on it, a few highlights on the controlled and emergency medications, and a quick review of some of the more common medication errors. When we talk about delegation, there are 5 rights of delegation, and generally this is associated with the nurses appropriating the tasks to licensed and unlicensed personnel. When you delegate a task, it should be the right task. It must be appropriate to delegate. It should be under the right circumstances. The delegation has to be appropriate to the client and the practice setting. It must be made to the right person. The nurse has to ensure the right task is being delegated to the right person who is validated as being competent to perform that task. There has to be the right communication. The nurse must provide clear, concise instructions for performing the task, and the right supervision, where the nurse must provide appropriate supervision and monitoring, and then give evaluation and feedback of the performance of the delegated task. When you delegate tasks, the instructions need to be clear, concise, and specific, appropriate per the policy and procedure of your facility. Should be based on the education, skill, and training of what is being delegated. Your doctor's orders should only be faxed per policy. The only telephone orders allowed are for the anticoagulant Coumadin and or warfarin. Preferably, the nurse can even write the order and fax it to the provider for their signature. That will ensure an additional degree of safety. Other than the anticoagulant, all MD orders need to be faxed only. Any unlicensed personnel who assist with medication administration via nurse delegation should have a minimum of 4 hours educational programs on medications. MedTechs cannot dispose of medications, and MedTechs are also not trained to follow orders from physicians or pharmacists. A nurse may delegate as needed medications or PRN medications as long as they contain the following. It should provide written instructions, and this administration is authorized by the supervising nurse on duty or on call. The nurses can also delegate nursing tasks to any unlicensed assistive personnel, such as family members, personal care service providers, or consumer-directed personal care attendants, as long as they have the competency to perform the specific task that is being delegated. Nurses should follow the same protocols for delegating to unlicensed personnel as they do for licensed personnel. It is the nurse's responsibility. A nurse cannot delegate any of the following: any medication administered via a parenteral route, for example, intravenous, subcutaneous, or intramuscular, IV, SC, or IM. You can delegate all the rest, the topical, the oral, nasal, ocular or eye, auricular or ear, vaginal, rectal, or enteral tube medications. A nurse cannot delegate the injection of insulin or epinephrine from a labeled or preset, pre-drawn delivery device, or any medication given via an NG tube. Most importantly, the nurse needs to give the initial dose of any new medication, and any previously prescribed medication that has had a dosage change cannot be delegated. It must be given by a When preparing to give medications, the med cart needs to be checked prior to start for all the supplies you will need for the safe and proper administration of medications. This includes, but is not limited to, a fresh pitcher of water, spoons and med cups, fresh applesauce and or yogurt, tissues, medication crushing device, and the hand sanitizer for keeping your hands clean. There should be adequate lighting on the cart, and there should be a medication drug book handy so that you can look up any new or unfamiliar medications for review. If you have any questions, with storing medications, the storage of the topicals, the powders, the creams, the patches, they are to be stored so that there is no cross-contamination with the oral, the otic, ear, ophthalmic, eye, or parenteral medications. A med cart should be locked at all times if it is not attended. The keys are to be kept on authorized personnel at all times and never leave the facility. Refrigerator temperature checks need to be done, and only medications are to be kept in the refrigerator. No food, no lunches, and it should be locked at all times. The expiration dates on medications should be noted, and if the medications are light sensitive. If any multi-use or multi-dose medications are opened, the date it was opened should be on that item. Controlled medications need to be locked within a locked room and keys only given to the authorized personnel. We will discuss a little more about that later. Of all. The single most important thing you can do to safeguard the health of yourself and others is wash your hands. You may use an alcohol-based hand sanitizer in place of the soap and water, but you must wash your hands before giving medications and then again after you have given a medication to each individual. The medication administration must have your complete attention. Keep the interruptions to a minimum. Focus on your task completion. Always give medications in a quiet area, free from distractions. Never, ever leave medications unattended, not even for a brief moment. In general, to give medications, it really requires a basic knowledge and sound judgment of what that medicine is, its mode of action, its side effects, its toxicity, the usual doses, the rate and route of excretion, and interaction with other drugs. It's just a basic, bare bones idea of what medicine are you passing and what will it do. If you have the drug book on the med cart, it's easy to look up any unfamiliar or new medications, and this is great for your own learning as well. The Medication Administration Record, or MAR, has requirements that need to be documented as well. On each MAR, they should have the name of the resident, the medication, the strength, the dose, the route, the frequency, the date it was ordered, the name of the prescriber, and the expiration date if applicable. Allergies need to be clearly marked on the MAR. The date and time the medication is to be given, along with your initials and signature and title. When you add a new order, all of the above needs to be clearly documented. Remember, no telephone orders, except for Coumadin and warfarin, are allowed, and even those should be followed up with a faxed signed copy. When you discontinue or change medication, highlight the old order if it was discontinued, and make sure the new or changed order is written clearly with all the above requirements. Get a new label from the pharmacy as soon as possible, and make sure that it's clearly marked change without obstructing the original. You will sometimes come across refusals to the medications. Try to address the issues that relate to that refusal and reattempt to dispense it. But if after a time it is not possible to be given, you should circle your initials, write the reason it was refused or omitted, and have it documented, and the doctor should be notified unless there are specific parameters. When giving a PRN or as-needed medication, it should say what it's used for, any special precautions or limitations, and the maximum doses allowed in 24 hours. You should chart the date and the time it was given and the reason it was given, and most importantly, you need to document the effect. PRN medications must be followed up after they were given for how effective were they. That should be documented. With regard to refills, you should contact the pharmacy at least 7 days prior to the last dose unless the medicine is on auto refill. Contact the doctor if a new order is needed, and log any refills on the refill roster and the medication record when received. Medication rights, each and every time to prevent medication errors. You may have heard there were 5. There are really 6 rights of medication administration. The 6 rights of medication administration, which we will go over individually, is the right resident, the right medication, the right route, the right dose, the right time, and the right documentation. All 6 of these rights need to be done every single medication, every single resident, every single time. When giving medications, it is preferred that you do triple checks or 3 checks with every medication you pick up. A triple check makes sure that all the rights are present. Your first check is when you remove the medication from the locked area and you check the prescription label against the medication log to make sure that they match for the name, the medication, the dose, route, and time. A second check, you look at it again before you pour the medication. Check the label against the medication order to make sure they match. And the third check, after you pour the medication, but before you give it, check that label again against the medication log and make sure that they match for the name, medication, dose, time, and route. These triple checks are very important when you pull it out, before you pour it, and right after you pour it. The first right is the right resident. In order to make sure you're going to give the medication to the right individual, you have to be able to identify that individual. Compare the individual's name on the prescription label, the medication order, and the medication log. Make sure they match. Ask the patient to state their name and birth date if they're able to, but verify the correct resident with the supplied photo ID if they are unable to do so. Verify patient's allergies every time on the MAR before you give that medication. Number 2, the right medication. Read that medication level carefully because some meds have more than one name, a brand name and at least a generic name. Check the spelling carefully. If there is any doubt at all about whether the medication name is correct, stop and check. Read the order carefully. Make sure the name on the order matches the name on the label. When it comes to the right medication, you cannot stress this step enough. Read the medication log carefully. Be sure that it's the name on the label, the order, and the log. They all match before you give it. Those triple checks are super important. Look at the medicine after you've poured it. If there is anything different about the size, shape, or color of the medicine, call the pharmacist before you give it. It could be a different generic brand of the medication, or it could mean you have the wrong medication. If they do not match, or if there is any doubt at all that you are giving the right medication, stop and check. Number 3, the right dose. The right dose is how much of the medication are you supposed to give the individual at one time. To determine this dose, you need to know the strength of each medication. In the case of liquid medicines, you need to know the strength of the medicine in each liquid measure. The dose will equal the strength of the medication multiplied by the amount. For instance, when you're comparing the dose on the prescription label, the medicine order, and the medication log, the strength of each pill is 250 milligrams. The dose is ordered at 500 milligrams twice a day. Therefore, the strength, 250, times the amount you will be given, 2 tabs, will equal the 500 milligram dose. Always, always question any order that requires giving more than 3 tablets or capsules of the same medication in one dose. It could be an overdosage. Generally, you never need to give more than 2 tablets at one time. Number 4, the right route. Drugs can be introduced into the body by several different routes, the most common being taken by mouth orally, PO, given by injection into a vein, IV, into a muscle, IM, or beneath the skin, SC or sub-Q. It can be placed under the tongue, sublingually, SL, or between the gums and cheek, buccally. It can also be inserted into the rectum, PR, or via the vagina, vaginally. They can be placed into the eye by the ocular route or by the ear, the otic route. Can be sprayed into the nose and absorbed through the nasal membranes nasally, breathed into the lungs, usually through the mouth by inhalation or MDI, or mouth and nose by nebulization. They can be applied to the skin cutaneously for a local, which is topical, or a body-wide systemic effect. It can also be delivered through the skin by a patch transdermally for a systemic effect. With regard to the right route, you should always crush meds with the appropriate food per the pharmacist's recommendation. Always use the appropriate medication crushing device. The resident should always be told that they're taking a medication, and use extra caution when giving medications by different routes to the same individual. For instance, if you're giving an eye drop and an ear drop at the same time and you become distracted, you could accidentally put the eardrops into the individual's eye. That would be a med error. When it comes to injections, they should only be given by licensed personnel and only medications that they personally have drawn up or were pre-drawn by the pharmacy or manufacturer. With regards to the MDI inhalers, if more than one puff is required, whether it's from the same or different medication, there is always a 1-minute wait between puffs, except for albuterol or other short-acting agents where 15 to 30 seconds is acceptable. It's common now that surveyors are citing facilities for the failure to have the resident rinse after using the steroid inhalers. They've also been citing facilities because of the order of the MDIs are given. You should always give the bronchodilators first. Number 5, medications need to be given at the right time. Medications are to be given to the resident no more than 30 minutes before and up to 30 minutes after the assigned time. For example, 8 a.m. medication can be given anytime between 7:30 a.m. and 8:30 a.m. The correct time also includes the correct frequency of the dose. Always check to see when the last dose of the medication was given. Some medications must be given before meals, 1 hour after meals, or at bedtime in order to work best. This half-hour time frame does not apply to PRN medications. If you have a PRN medication, for example Tylenol, that needs to be given every 4 hours as needed, you cannot give it until 4 hours have passed. Number 6, the right documentation. When a medicine is administered, it must be documented, and the documentation must be done at the time you give the medication. If you give a medicine late, you must document the actual time you gave it. If the med is not given, you must document that it was not given and the reason why. Circle your initials. Circled initials always mean a medication was not given. No pencil or whiteout can be used on the MAR. Never cross out or write over any documentation. If you do make a mistake, circle your mistake. Write a note on the log to explain what happened. All adverse reactions, unexpected side effects, and med errors are to be documented in the resident's chart, and a report made to the practitioner or agent and guardian immediately, documented as well in the chart that it was done. A written report of the incident is to be put on the resident record. You should always sign the MAR immediately once the medication is given. There should be no blank entries on the medication record at all. That is considered a medication error. There should be a signed or circled initial in every spot. Also, never document before a medication is administered. Since the Just a few comments regarding the controlled and emergency medications that are kept at the facilities. With regard to the controlled medications or narcotics at the facility, they should always be stored locked within a locked area. The keys should only be accessed by authorized personnel, and they never leave the facility. Narcotic counts are done daily, one from each shift coming into review. Disposal of any narcotics require 2 people to witness and sign, date, amount, and documented in the resident's record. Expiration dates of the narcotics need to be checked regularly. And with regard to drug diversion, any discrepancy in the counts need to be reported immediately to the administrator, and you are encouraged to report any suspected drug diversion immediately. Last dose. With regard to the emergency medication kit, if there are controlled substances, it shall be closed with a tamper-proof seal and kept in a locked medroom, cart, or closet. Only the Director of Nursing, RN, or LPN on duty, pharmacist, or practitioner shall have access to the controlled substances in the emergency drug kit, and they are to be administered by authorized personnel. A usage record is contained in each emergency drug kit for every drug that is included and needs to be completed by the nursing staff when any medication is used from this kit. Generally, the controlled substances and expiration dates are checked by the pharmacist at least monthly and documented. When the kit is open, the pharmacist needs to be notified within 24 hours. Shift counts need to be done on all controlled substances until that kit is resealed by the pharmacist. Once the kit is resealed, the counts are no longer required. There are a few common medication errors I'd just like to review. Most common errors include the wrong medication, especially with those that sound alike, the wrong resident, because the photo ID wasn't checked or you did not ask a name or date of birth, if that was possible. If you gave it at the wrong time, the dose or the route, and that's where the triple checks help you with this. If you crush a medication or you make it in the wrong way, you have to be sure that it's safe to change that form. If a medication is unavailable, that is considered an error. There is no longer a refill or a loss of medication. And most importantly, an error of omission, meaning there is a hole in the MAR. It was not signed, it was not circled, you have no idea if it was given or not. That is a medication error. And if you ever see a hole in the MAR, please report. Other common med errors include inappropriate delegation of medication or giving a medication when there is a documented allergy. If you use discontinued, expired, or contaminated medications, that is an error. You should always review vitals and trends prior to giving high-risk medications, such as blood pressure or nitroglycerin medications. Checking the blood pressure to see what it's running before you give the medication. If there are frequent interruptions and a lack of focus on the medication administration, that leads to med errors. If there are refills that are not being done or borrowing from other residents, that is not allowed and can lead to med errors. Documentation should always be timely and accurate. There should be no use of unacceptable abbreviations. JCAHO has a list of those abbreviations that are recommended for use. These are a few of the abbreviations you should never see on the MAR. Do not use a U for unit. You can mistake it for a 0 or the number 4. Write out the word unit. International units, or IU, can be mistaken for IV or the number 10. Write out international unit. Do not use QD, QD, daily, QOD, every other day. They are always frequently mistaken for each other. Always write out daily or every other day. Importantly, do not use trailing zeros or lack of a leading zero when you're writing out the milligrams. The decimal point can be missed. For example, if you have X milligrams or 0.x milligrams, the leading zero should always be in front of anything less than 1, 0.4. Do not write 0.4 milligrams. A trailing zero or ending zero should never be used after a decimal. If it's a single number, write 4 milligrams, not 4.0. Also, for morphine and magnesium, it could mean either one if you just write MsO4, MgSO4. Write out morphine sulfate or magnesium sulfate. A few of the more common med errors found in long-term care facilities include failure to shake the medications as required by the label, mixing, rolling, or creating air bubbles in insulin, crushing meds on the no crush list, giving the incorrect amount or type of fluids, giving medications before meals instead of with meals, giving meds with meals instead of before, and failure to administer those inhalers, those MDIs, in the correct order and with sufficient time between the puffs. Other medication do's and don'ts include do not give the outdated or expired medications or any medication beyond the stop date. If the medicines do not look right, if they have changed color or consistency, make sure you give only medications taken from the properly labeled container. Do those triple checks. Never pre-pour the medication. Do it just before you're about to give it. Never give medicine that was prepared by another person. And never administer medication that is not labeled. Other medication do's and don'ts include never give medications without a written order, and that includes the over-the-counter medications or OTC. Do not borrow from another resident. Always remain with the resident until the medication is completely taken. Do not keep stock meds for just in case. And any discontinued and expired meds must be disposed of as per policy. When giving medicines, you should prepare for one individual at a time using the triple checks and give it to the individual as soon as you prepare it. Document it immediately, whether it was given, refused, omitted, and the reason. Do not talk to others or ask them to talk to you when you are giving medications. You must focus entirely on your medication task. Do not stop to do something else in the middle of giving medications. And at all times, pay close attention. I cannot stress this enough. Those medications are of prime importance to have your full focus. A few key points for review. Review your MAR for completeness and accuracy, especially at the end of your shift, being sure you have signed off everything. Plan your schedule to maximize your workflow and your concentration. Avoid distractions at all costs while giving out medications. Prepare your med cart prior to the start and pay attention. Always wash your hands prior to and after giving each medication. Follow the 6 rights for every resident every time. Remember, those few extra minutes you take to triple check your medication before you dispense to each resident, you can save time, money, and lives. If ever in doubt, check it out. Thank you for your attention. Original label. Of anything about that medication. Nurse. Regarding medications or treatments.